Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Cernaianu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. So this is part 2 of the mini-series of why my practice and other practices are going concierge. Now, this is a little bit more specific to me. And in this episode, I'm going to give you my top 5 reasons why I have decided to do a membership-only practice. And let me start with reason number 1. That is financial survival. If you listen to my previous podcast episodes, not just the one before this one, but the ones from previous years, you will know that I've been speaking about it, and this is not something new that you're like, oh, I just found out about it. The fact that the healthcare system is broken and it's messed up. You, the client, customer, patient, are at one end. Us, the doctors or medical providers, are at the other end. You need care from us, the doctors, the medical providers. We provide it. Well, what's interesting, and this is the messed up part, in between us, you, the client, and us, the provider, you needing the service and us providing the service, there's an insane number of layers of organizations that have insinuated themselves in between you, the client, and us, the doctor, all in the name of regulation or control and profit, all shaded and hidden under names like customer safety, quality assurance, patient satisfaction. But this is all very clear to those who can see and understand. Our healthcare system has been hijacked and is broken, messed up, and compromised, and something has to change. The private practice in the American healthcare system has known many ups and downs. Private practice started back in 1700s. The doctors back then were learning their trade from the previous town doctors. They were going from house to house, treating pretty much anything from lacerations to fevers and delivering babies. In mid-1800s, the American Medical Association was founded, and the American landscape became more and more over time, from the mid-1800s to today, a landscape dominated by large organizations. And more doctors have chosen to forsake independence and autonomy for the perks of financial security and financial guarantees. The current percentage of physicians who are owners in a private practice is 44%. Almost 50% of doctors are actually employed. The very few rest are independent contractors. Well, how come? Well, the cost of managing a medical practice has surged to highest ever. Labor costs, rent, premiums for malpractice insurance have gone up in the last 5 to 10 years significantly. My malpractice premium with the same company from inception of the practice has gone up for no reason except for the fact that it's California and they have to comply with some crazy regulations instituted by probably our governor or who the heck knows came up with this grant idea, but it went up by $10,000 to $12,000 in the past 2 years. And us, the doctors, have to make investments in information technology like computers. The internet, we have to wire our offices for it. We need cellular technology and electronic medical records and patient portal access. All of these are considerable expenses. Consider all these ever-growing expenses with the concomitant decline in insurance and Medicare payments that had not only kept pace with inflation. You think, okay, well, the payments have been the same, but inflation has, eroded our payments. No. They have been consistently cut over the past 10 to 20 years steadily, to the point that doctors have no choice but to go cash, stop accepting insurance, or go concierge. Now, here's our situation. Hera Healthcare, also known as Hera Beauty and Wellness, can no longer survive accepting insurance unless we either start a concierge membership model and put a price on all the admin services that are expected but not reimbursed, more to come on that, or I simply go out of network with all insurance plans, including Medicare, name my own price for consults and treatments, and will have to limit practice access to only patients that can afford my services. It will break my heart. I'll have to say goodbye to so many beautiful ladies that I literally feel are my family. They've been with me for 12 years from the beginning of the practice. I don't want to do that. The decision to implement a membership fee, it's not greed. It's not desire for profits. Because I am just like most doctors in private practice, a person who has decided to forego financial security and financial guarantees for the sake of autonomy. Please be aware that most private doctors that are owner of a solo private practice are likely either broke or close to being broke. I am not building an empire like some people have told me. I have no one to leave an empire to. However, I do want to build a legacy and start showing the world that in a time when healthcare is deteriorating and becoming more and more fragmented and specialized, more and more focused on medication and procedure driven, and more expensive, I want to show the world that there is a way to practice medicine in a holistic, comprehensive way, focused on the actual cause of the healthcare problem. A way to partner with the patient so that they are accountable and active participants in their care, not just spectators on how their body will respond to a drug or surgery. I want to build a practice that offers comprehensive wellness focused care, a practice focused on true and proven anti-aging technologies, a practice focused not on hormone replacement, but on hormone optimization, and a practice who, above all else, cares about results of such treatment while maintaining patient safety with the appropriate needed surveillance and great communication with our patients. And all of this while accepting insurance. But it all relies on patient and customers understanding that if they believe and support this vision of mine, then becoming members is the only way to get access to what we offer. So financial survival was top reason. Number 2, I want to give my patients the gift of time. So at this point, you're probably saying, well, you have your own practice, you're your own boss. No one is telling you, lady, how much time to spend for the patient, so why don't you? Well, let me explain. In an insurance-driven healthcare market where I have decided to continue to accept Medicare and insurance PPO plans, a physician, a provider, not just physicians, PAs, nurse practitioners are the same, we are actually penalized monetarily and financially if we decide to spend a longer time with the patient. That's crazy, right? But that is the truth. And if you didn't know that, let me explain. Of course, billing by time gets you paid more the more time you spend with the patient. So I spend 20 minutes, I get paid a certain amount. I spend 30 minutes, get paid more. However, if I see a patient for about 15 minutes, maybe 10, I manage to stagger minimum 4 patients in an hour, maybe 5 or 6. Then the practice will make way more money per hour than if I would have seen 1 patient in that hour. That's crazy, right? You think it would be the same, but it's not. So a simple visit could pay $60 to $90, but a high complexity visit does not pay more than $200 some. So if I could jam 4 simple visits, I would make twice as much money than just spending an hour with the patient. Now, in a model like the one I want to practice, where I spend time because I need to understand the problem, I want to have time to discuss testing and options and discuss and educate on treatment options. In a practice model where I want to give my patients the gift of time to get to the root cause and provide a meaningful solution, accepting the PPO insurance will penalize me monetarily, and I actually lose money by practicing this model. So if I spend time with you, it's at my loss. If you wonder why your other doctors are not spending more time with you, that is why. Your doctor or his employer is getting paid more if he's billing less complexity visits per more visits in 1 hour. So in a healthcare system that's driven by monetary greed, if a doctor would like to spend time with you, with the patient, to actually meaningfully understand what the problem is, maybe provide education, maybe counsel you in detail about treatment options, all of that becomes impossible in today's environment. And do not blame your employed physician that is working for a corporation if they don't spend time with you. Don't blame your private doctor if they're not spending time with you. They do not have the luxury of time because someone else decides how much time they will spend with the patient doing what exactly, and that private doctor will have to hustle to keep the lights on. So in order to preserve the possibility of allowing the practice to dictate how much time is spent for a patient based on the patient needs and the complexity of the nature of the problem the patient has, we have to implement a fee that provides and covers the administrative benefits and allows the practice to set the load of patients we see daily to a number that makes sense financially, but a number that preserves and respects our principles and beliefs. And let me tell you more about the administrative benefits, because that ties me into reason number 3. And the reason number 3 is the need for enhanced communication with the patient outside medical visits. So I mentioned earlier, the healthcare system is a business. It's actually big business nowadays. So it has been taken over by corporations and investors who know business very well. And you go to a clinic and you see a doctor that's employed by an entity, it will be all about the business, right? So let me explain in a little bit more detail what I mean by that. Using insurance for your visit means that any interaction that the practice has with you outside your visit is done for free, on time borrowed from other activities that could be spent on face-to-face, in-person or telehealth, patient visits, which are actually generating revenue. Now, you, the client, at some point, might expect medical staff to help answer your questions after a doctor's visit. You make an appointment and you have questions that need to be answered. You expect your doctor's office to honor your request for a refill because you're running out of medications. You expect your doctor's office to change your pharmacy and reroute your prescription to a new pharmacy for various reasons. You lost the lab slip and need another one emailed to you. You expect the doctor's office to change your appointment at no cost to you when something came up and you need an appointment change. And then you spend a lot of time on the phone trying to decide what works best for your schedule and what fits the doctor's availability. You expect the medical staff to spend valuable time they do not have helping you figure out what your bill is for, though that is not their job. But we're first line of defense. We're there, we're with you, we're first line of customer service. And on top of that, there are some people who expect to cancel appointments same day or simply do not show up for a visit without any penalty. And I could go on and on. There's a long list of all kinds of services that fall under customer care. All of these are absolutely non-billable, non-payable by your insurance company or by Medicare, but they are services you need. There are services that are rounding up your appointment. Now, here's the thing. Back in the day when insurance companies paid more fairly and when costs of running a medical practice were not so high, all the doctors and their medical staff agreed that such requests could be honored and supported at no cost. Now, let's be real. Those times are gone. Now, for everything I just mentioned, there is a cost, and that cost will be covered by an admin membership fee or for your practice going concierge. You might have noticed that many clinics or doctor's offices do not have the capacity for staffing or technology dedicated to prompt and meaningful communication in between visits. Fortunately for my patients, I realized that this type of need of communication is essential as the practice grew and became more and more customer-centric. I understood it and I found a solution. It's not cheap, and it cost us money not to have additional cell phone lines on my account. That's not the expense. Obviously, you have to pay for the cell phones themselves, which is unfortunately expensive. It costs more in labor to staff those cell phone lines, and it costs time to take care of all the messages that are coming through to the cell phone lines. But it's worth it because the patients are happy, and now they have modern technology to communicate with the doctor's office right at their fingertips. How many of you listening to my podcast can honestly say you can text your doctor's office on a regular basis and get immediate response? For this exact benefit, many of my clients have joined the membership and agreed to pay the monthly rate, which is not cheap. But most patients feel that this type of communication is absolutely priceless in today's world of broken, messed up healthcare system, and they understand the value and they're willing to pay for it. Another reason for why I decided to go concierge is I want to be able to offer same-day appointments. And this is a really big perk, a big patient perk. Allowing same-day appointments for patients that need it medically or due to personal restrictions for travel or availability or an emergency situation, that's again priceless. I can't tell you how many patients have called desperate. How soon can I see the doctor? My staff is smart enough not to say, well, the doctor's fully booked for 2 months. They ask, what is the emergency? What's going on? What would you like to see the doctor for? Oh my God, I have this horrible thing and turns out it's a big complication and I have a problem and I'm in a lot of pain and I've called 3 doctor's offices and I can't get through. Please help me. Immediately, they get put on hold. The medical staff comes and asks me, Dr. C, this is the situation. What can we do? I look at my schedule. I say, I'll see her today before the end of my day. She could be the last patient. I'll stay longer if I have to. That is, again, priceless. And a significant number of patients have actually become customers and have agreed to pay the membership fee because this is how they joined. They had an emergency and I was the only doctor who said yes to them. Now, why can I do that? Because I'm not overbooking. I'm not overloading myself or my mid-levels to the point where we deny care. That is important for my vision. Should I force, for the sake of profit, a fully booked schedule when a same-day appointment request would come in for an emergency? They would get double booked. They could become tired, overworked. They could become resentful of the scheduling staff or of the leadership. That's me. And that might reflect on their ability to give you their best. So my opinion as a leader is that overbooking, double booking is not a way to practice medicine. However, our members have to pay for that privilege of being able to come in same day or to call us at the end of the day, say, can I come in tomorrow? I have a problem. And last but not least, reason number 5 for going concierge and implementing a membership fee is the desire to spend time providing education. And again, that's not desire that comes because I like educating people. It's a desire driven by the need of our clients. As I mentioned before, time is very costly in healthcare. If you think nothing about the 15 to 20 minute phone call that you have with a staff member while you're trying to go through our daily schedule, your daily schedule, and find a time that would allow minimal sacrifice on your part that would fit your schedule the best, then I ask you to think about how that time on the other side, on the side of the medical staff, is spent just talking to you, helping your needs, away from any productive revenue generating service. You expect that staff member to be at your beck and call, answering all your questions, satisfying your needs, absolutely for free. So in order to understand the problem, you have to put yourself in someone else's shoes. The business of medicine has become an extremely transactional business. We have made so many appointments where staff has spent a lot of time explaining the practice, what we do, how we care for our patients, what are your requirements for financial responsibility, and ultimately spend time registering the patients, making an appointment, occupying a significant chunk of time in my schedule to ultimately have a cancellation or no-show. So after years of dealing with this problem, luckily it happens rarely, but it happens. We are now requiring and have imposed a non-refundable registration fee. We're just done with that, right? Most practices do it now because people are doctor shopping. And that's time consuming on your part, but it's a business loss on our side. We now, since implementing that, have less than 1% no-show, same-day cancellation request because we have a $79 non-refundable registration fee applies immediately. You lost your registration fee and we'll ask you to pay it again if you don't show up or you same-day cancel. We enroll new members in the concierge program last year for this fee. So basically, the $79 registration fee gave them access to the membership for 1 month. So we offered them benefits for the registration fee. Again, I believe we should be offering something of value for everything that's paid to the practice. So I didn't just want to take their money. But anyway, I diverged a little bit. Let me get back to my education piece. So we need time to spend on education. And my staff is constantly trained to discuss and explain the practice, how we practice medicine, explain the fact that we provide comprehensive care with a holistic view. Almost all my staff have received care with one or all the providers, so they are prepared to answer your questions. A lot of the times, the education doesn't come just from me, the provider, or my other providers. It also comes from our staff around the provider. Every week, I spend 2 hours every Wednesday morning. We look at the practice organization, we look at customer feedback, we look at questions we get. How can I spend my time training and preparing staff to answer all customer questions? Because we want to educate and we want to inform you of what we do and how we do things. Why? Because an educated and smart patient is much easier to take care of than someone who doesn't understand the severity and the complexity of the health situation they are facing. They might not understand how crucial compliance with taking medication a certain way at a certain time will be, or that scheduling a certain test at a certain point in their cycle, or after or before they've taken their medication, it's very important to maximize the provider's ability to interpret the test results. As a practice, we need the admin time required to spend educating our staff and educating patients outside the visit. We care about our patients. And unfortunately, we can no longer practice without putting a monetary value on this time, hence the membership. Now, obviously, patients with access to our cell phone lines who have the VIP membership will also get the gift of prompt communication with the staff, regardless of the reason for the communication. So these are my top 5 reasons for going concierge. And you might agree with some of them, might not agree. You might think some of them are useful to you, some of them are not. Ultimately, your decision on whether or not to join a membership practice like mine or another practice is a personal decision. It does have to make sense to you financially, and ultimately, everybody puts a price on what they value the most. Now, I'm going to end here with a very interesting little thing. It is astonishing to me that some women value carrying a brand name purse much more than spending money on their health. I cannot tell you how many times a woman has come into my practice and complained about the cost of a hormonal treatment that has changed her life, that has made her feel so much better, while she is proudly displaying a Louis Vuitton bag that costs thousands of dollars. Women are very interesting creatures, and it's unfortunate that some value things that are not meaningful at all than realizing that investing in their health is actually priceless. Now, I feel I've preached about this topic many times on social media in my other podcast episodes. If we do not have good health, the rest does not matter. You cannot enjoy the money in your bank account. You cannot enjoy your Louis Vuitton bag. You cannot enjoy your nice clothes and purse and nice shoes because you might not have the energy, you might not feel well or look well, You might not be able to do all the fun things and enjoy your wealth. Investing in your health should be more important than investing in your bank account or in a pretty brand name purse or pair of shoes. We love purses and shoes. Only one thing matters in the end, and that is how we feel and how we preserve and take care of our bodies. As a practice, if you don't remember my mission from the first episode in this mini-series, I want to show the world that in a time when healthcare is deteriorating and becoming more and more fragmented and specialized, more and more focused on medication and procedure-driven, and more expensive, I want to practice medicine in a way that's comprehensive, holistic, focused on the actual cause of the problem. I want to partner with the patient, with you, so that you are accountable and you are an active participant in your care. You're not just simply a spectator on how your body will respond to a drug or a surgery. I want to build a practice that offers comprehensive, wellness-focused care, not disease-based model. A practice that is focused on true and proven anti-aging technologies. A practice focused on hormone optimization, not just hormone replacement. A practice that it's all about you. So if you believe in my vision and it aligns with your goals and your values and you can afford the cost, then I would love to have you be one of our members. Otherwise, don't blame your doctor for going concierge because it's not their fault. Get mad at the people behind the curtain. Thank you for listening. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.